Hello, my name is Lindsay. I'm going to be the nurse taking care of you today. We're going to be doing a complete head-to-toe physical assessment. You do have the right to refuse treatment at any point. Just know that that is always an option. So we're going to start off at the top. We're going to do an inspection of the skin on your face. Make sure everything is of normal color, no splotches, no blemishes. I'm also going to make sure that everything is symmetrical. I'm going to palpate now. Just going to feel the skin on your forehead and your scalp. Make sure there aren't any nodules or lesions, any indents in the skull. So everything feels normal. So your expression, everything seems symmetrical, blinking together. So we're going to check your temporal arteries now. So everything feels normal. It's not bounding. It wasn't difficult to palpate. I'm also going to check for TMJ. So can you open your mouth? Close it. Okay, open it again. So there aren't any clicks or glitches or not uncomfortable. It's not painful when you do that. Okay. So I'm going to evaluate the strength of your teeth. So can you clench your teeth together? All right. Can you try and resist? All right, perfect. All right, now I'm going to get you to close your eyes for me. We're going to test your cranial nerve number 5. Just tell me if you can feel this.
Yes.
Okay.
Yes.
Okay. You can feel that on both sides, bilaterally. We're going to test cranial nerve number 7 now. So can I get you to smile? All right, can I get you to frown? All right, close your eyes tightly. All right, you can open them, lift your eyebrows. Show your teeth. All right, can you puff your cheeks out? All right, so everything seems to be normal. Again, we're looking for symmetry. Everything is okay bilaterally. Congratulations on cranial nerve number 7. All right, so next we're going to test your eyes. We're going to test the second cranial nerve. So we're going to do it with the Snellen chart. So since you do have eyeglasses, we're going to leave those on for this test. And I have the Snellen chart over on this side. So if you could stand, this is going to be about 10 feet away. If you could stand there, and if you could, all right, cover your right eye and read the first line that you can read clearly.
HPXTZFN.
Okay, and can you switch arms, cover the left eye and read the first line that you can see legibly?
HPXTZFN.
Okay, great, so that's 20/20 from 10 feet away. So the glasses seem to be a good fit for you. All right, next I'm going to take a peek at your eyes. We're going to test your extraocular movement. So if you could just follow both eyes, don't move your head. We're checking for conjugation, make sure that they're moving together, which they are. We're going to use the pen light next. We're going to check kind of the size and reaction time to the light. So keep looking forward. All right, both pupils did react. So let's say about a 4, but both are equal, round, reactive to light. Let's see. We've got nice, evenly distributed eyelash growth, eyebrow growth. Just going to kind of pull your eyelids down here. All right. So you have kind of like blue-green irises, white sclera. There's no sort of discharge or mucus in the eyes. Everything appears to be normal. Accommodation was normal in the eyes as well. Can you watch my finger? Okay, perfect. Everything seems to be working together. All right, so moving right along, we're going to do your some ear tests now. I'm just going to look at the outside of both of your ears. Everything's smooth, and no lesions. There aren't any bumps. Any pain when I do that? Okay, so we're going to do the whisper test. What did I say?
Let's
Let's try one more time.
bookstore.
Yes. All right. Let's see, that was the right ear. That was the left ear. Okay.
Station wagon.
Yes. All right, so there seems to be maybe a little bit difference in the two. Do you have any discrepancies in hearing better in one ear than the other?
No.
Okay. Maybe I just did the whisper test wrong. All right, so I'm going to look at your nose next. Just going to look at the outside. Doesn't appear to be any kind of bony prominences, any weird strictures, or anything unusual going on. So we're going to test the patency of both of your nostrils. So can you close one, breathe in? Okay, do it with the other side now. Okay, so seems to be pretty clear bilaterally, both nostrils. So next I'm going to check your maxillary and frontal sinuses. So do you have any pain or pressure when I do this?
No.
Okay. What about up here?
No.
Okay. So everything appears normal with the maxillary and frontal sinuses. Next we're going to do the mouth and throat. So I'm going to use my pen light again. Can you say ah? Take your time out, say ah. Okay. So we're checking the hard palate, the soft palate, the inside of the mouth, the mucosa, the uvula, the tongue. Everything seems pale pink, like there are no bright red, there were no ulcerations. Everything appears to be healthy. I could see your tonsils, so those are still intact. When you say ah, the uvula does raise, which is normal. And can you stick out your tongue one more time? Okay, so we're looking for symmetry with this. You can put it back in. So we're looking for symmetry when you stick out your tongue, so that's normal as well. So we need to check the pharynx also. Can you open and say ah one more time? Okay. So there doesn't appear to be any drainage, nothing going down the back of the throat. Pharynx seems to be along the same lines of the rest of the mucosa, hard and soft palate. So, all right. So next I'm going to check the lymph nodes in your face, in your head and neck. So we're going to do the pre-auricular. It's going to be before the ears, post-auricular, behind the ears. The occipital is going to be at the back of the head. We're going to do submandibular, consular. Can you turn your head to one side? The other side. This is going to be the deep cervical chain. We're going to do the supraclavicular. And then there's some below as well. So clavicular, superficial cervical. Superficial cervical. So it shouldn't be able to palpate the lymph nodes, which I can't, which is good. If there were any infection, they would be swollen. But if I were able to palpate them, they should be kind of squishy. They shouldn't be hard or beady-like. All right, so we're going to check the range of motion in your head and neck. So can you put your chin to your chest? All right. Come back up. Can you go side to side? Can you do ear to shoulders on both sides? All right, and can you look all the way back? Okay, so we have good range of motion. All right, can you shrug your shoulders up against the pressure? All right, good. So far there haven't been any discrepancies in laterality. I haven't noticed from my examination one shoulder being stronger than the other, flexibility being different on each of the sides. All right, can you kind of put your head up a little bit for me? Check your trachea. Okay, so everything's midline, which is good. It's not going to one side or the other, which indicates some serious problems. And to check your thyroid, I'm going to have you drink some water. And if you can kind of turn to the side so I can feel from the, turn your whole body to the side. Just kind of a diagonal. Perfect. All right, I'll take a drink of water. Okay, good. So movement of the thyroid was good. There weren't any noticeable nodules. Should be kind of squirt and relax. Yeah, should be able to kind of move it back and forth, which I can. There aren't any issues with the thyroid that I've noticed. So we're gonna do carotid pulses as well. We'll check them one at a time. Okay, so both are pretty easily palpable. Again, they're not thready, they're not bounding. Everything seems normal there. I'm gonna check for bruise with the bell of my stethoscope. No bruise on either side, which is good because that also indicates a problem. All right, so now I'm going to get you to, you can take your shirt off and kind of turn facing this way at an angle, the other angle from before. The other angle from before. Not like just turn it face that way. Yeah, perfect. Just where we can see the back and we can kind of see what exactly I'm doing back here. Okay, so I'm just going to check and make sure that everything is symmetrical, that the shoulders aren't uneven, the sides of the back aren't uneven. Everything seems fine, looks fine. And I'm just going to kind of palpate here to see if there are any nodules or swollen lumps. Everything seems to be normal. Skin's warm, pink. I'm now going to check for tactile firmitus, just to make sure there's no congestion or consolidation. So I'm going to do that with kind of balling my hands into fists, and I'm going to get you to say 99, okay? 99.
99.
Can you say it again?
99.
One more time.
99.
Okay, perfect. So I should be able to feel kind of the vibration equally as you're saying that. So didn't notice any differences on the sides, so there doesn't seem to be any congestion or consolidation. So now I'm going to kind of percuss. I'm going to also check for flank pain. Does that hurt when I hit on the side? Okay, so no flank pain noted. I'm going to check for breath sounds as well. So I'm going to do that with just the normal part of my stethoscope. Okay, so breath sounds are equal, even, clear, no presence of adventitious lung sounds. All right, so now I'm going to get you to turn back and face front again. So I'm just going to kind of look at the arms. Again, we're checking for symmetry. We're checking for any sort of nodules or raised skins or anything that's unusual. All right, It seems to be fine on palpation. I'm going to check your pulses. I'm going to do both sides at the same time. I'm going to rate your pulses. So they seem to be equal on both sides, which is good. The differences in laterality. We're going to do your radio. So again, they're equal on both sides, not bounding, not threading. Then we're going to do radio. Okay. So again, good on both sides. No differences. Normal, not threading, not bounding. Let's see one of your hands. So we're going to check for capillary refill. Okay, so capillary refill is less than 2 seconds, which is good. Check the other side. Okay, capillary refill is less than 2 seconds on that side as well. I'm going to check your range of motion now. So can you put both shoulders like above your head, both arms above your head? All right, bring them back down. And can you put them back behind you? I have to turn a little bit. Okay. Any pain when you're doing any of that? No pain in the surgical shoulder?
A little in the right shoulder.
Okay. Can you adduct and abduct? Raise them up and put them back down? Okay, perfect. You get a good range of motion on both sides. Now I'm going to check the range of motion on your elbows. So can you flex up? Get back down, extend. All right, flex back up again. Right, try to push down. Okay. Extend. Try to pull up. Okay. Don't pull me up. And then can you pronate and supinate your forearms? Okay, perfect. We're going to check range of motion in your wrists next. Can you make a fist and open your fingers? Okay. And then can you put a thumb to each finger? You don't have to do it at the same time if you don't want. So we're going to do the cerebellar test next. So you're going to hold both arms out, and alternating arms, you're going to put one finger to your nose. The other arm out, yeah. Okay, do it one more time. Get a little bit faster. Keep going until I tell you stop. Okay, very good. Next, we're going to check for graphesthesia. So I'm going to have you close your eyes. Have you hold out your right hand. All right, can you tell me what that is? Oh, no, I'm sorry. We're checking for stereognosis first. So can you tell me what that is?
Key.
Okay. Can I see the other arm? You put the right arm down. Can you tell me what this one is?
Paper foot.
Okay. All right, I'm going to get you to keep your eyes closed. Now we're going to test for graphesthesia. Find my reflex here. Okay. All right. Now, tell me what I'm writing in your hand.
3.
Mm-hmm. Okay. Let's see the other side.
0.
Yeah, perfect. Okay, you can open your eyes. So now we're going to do, we're going to check your reflexes. So we're going to start with the right arm. We're going to check the tricep reflex first. So need your arms as relaxed as possible. Okay, so I did see actually a little bit of contraction in the tricep. We're going to do the bicep reflex next. So again, try and relax your arm. We should have a little bit of flex there. And then we are going to, last but not least, we're going to check your brachial reflex. So it's going to be on the thumb side. So we can see a little bit of flex in the thumb. We'll check this on the other side now. All right, as relaxed as possible. As relaxed as possible. Okay. So we did see a little bit of flex in the tricep. Do the biceps. Relax. That's the review. Alright, so we got some flexing with the thumb there. Everything seems to be within normal limits bilaterally. Reflexes, they're not, you don't have hyperreflexes and you don't have hyporeflexes. Alright, so I'm going to get you to lie down now. Your head on this pillow. So first we're just going to look at your breathing efforts and make sure that it's not labored, that you're not using accessory muscles. Everything on the chest looks normal. We're going to inspect it and palpate it, of course. That was the first place to start. So everything seems normal bilaterally. We're going to check your pericardium. So that's just this area right here above your heart. We're looking for PMI, pulsations, heaves, and thrills. Everything seems normal. I don't see any of those things in the precordium. So we're going to listen to your heart sounds now. We're going to start with the aortic. Then we're going to move to the pulmonic, tricuspid, and mitral. We're going to check it just with the normal side first. For this aortic, it's going to be on the right side, between the second and third clavicular space. Moving over to the pulmonic. The pulmonic is on the left side, still between the second and third intercostal space. A little bit down from there is going to be the tricuspid. And then the mitral. Alright, so now I hear S1, S2 sounds, even rate and rhythm. I didn't hear any unusual heart sounds, so just the S1, S2. And I'm going to go back and check for any unusual, like gallops. Do that with the bell side. We're going to do it in the same order. Aortic first. And pulmonic. Tricuspid. And mitral. Okay, so didn't hear any additional heart sounds. Heart sounds healthy. So next we're going to move on to the abdomen. So everything appears to be normal, and there's no bumps or ridges. The umbilicus is interned, inverted. Everything is symmetrical. There aren't any unusual pulsations on the abdomen. I'm going to listen to your bowel sounds. I'm going to start in the right upper quadrant and then move away. Move to the left side, down to the left lower quadrant, and then back to the right upper quadrant. So we do have active bowel sounds in all four quadrants. They don't appear to be hypo or hyperactive, so just normal bowel sounds in all four quadrants. So now I'm going to listen for your renal arteries and your aorta. I'm going to listen for any bruits that might be present there. We're going to do the right renal artery. We're going to do the left renal artery. this should be on either side of the umbilicus, slightly below it. And then for the aortic, it should be right above the umbilicus. And I don't hear anything, which is good. So now I'm going to percuss all the quadrants. That seems to be normal. And then next we're going to palpate the quadrants. You're going to start with the light palpation. And we're going to do it in the same order that we did at Listen for Vowel Sounds. So let me know if there's any pain or tenderness anywhere I press down. So nothing unusual observed with light palpation of the abdomen. So we're going to do a little bit deeper palpation. And again, let me know if there's any pain or tenderness when I press down. Okay, so everything feels normal upon deep palpation as well. We're going to check for, see if we can feel the liver. So it's going to be on the right side, right almost under the ribs. So unable to palpate the liver, which is common unless it's a sick patient with cirrhosis or something of that nature. All right, so now you're going to stay down lying. I'm going to look at the lower extremities. We're just going to check out your feet now, feet and legs. We're going to inspect and palpate. Make sure that we don't notice anything, again, knots, lesions, anything that's not supposed to be there. So everything seems normal bilaterally. Coloration is normal. We're going to check the pulses. So first we're going to do the popliteal pulses right on the kneecaps. So pulse is easy to palpate. Again, they're not bounding, they're not thready, they both normal. We're going to do dorsalis pedis. So on the tops of your feet here. Okay, and they're even and very easy to palpate actually. So again, not bounding, not thready. Everything is perfect bilaterally. And then dorsalis pedis. I'm sorry, posterior tibial. We just did dorsalis pedis. Okay, so they're a little bit more difficult to palpate than the dorsalis pedis, but you can find them. They appear normal bilaterally. We're going to check for pretibial edema. Make sure there's no swelling in the extremities. There doesn't seem to be any edema. Pretibial area. We're going to check your range of motion in your hips now. So can you lift one leg up about 90 degrees? Okay, you can bring it back down. Can you do it with the other? Okay. Can you bring your knee to your chest? And back down. Back down. Perfect. All right, can you bring the knees in towards each other? Yeah, kind of push into it. All right, and then turn them out. Okay, perfect. So now we're going to check range of motion in your feet. Can you push up? Can you push down? Okay. And when I'm pressing against, can you pull up? Okay, and press down. All right, so strength seems to be equal bilaterally. Again, no limitations. So normal strength, range of motion in both feet. And while you're lying here, we're going to test the Babinski reflex. Since we're not using the tongue depressor again, I'm going to do it with this instead of the reflex hammer. So can you kind of work your feet up? So you're going to start in the medial part of the foot and work your way up. Maybe I should do it with the hammer. We're going to try it with the hammer, just to make sure we get a noticeable response here. Okay. Ticklish? Okay, so that's normal. What we're looking for, we don't want the toes to fan out or point up. So the response that we got from that was completely normal. All right, now you can sit up for me. And you can put your shirt back on. We're going to turn this just a little bit since the couch is short. We need your legs to be dangling when we test these reflexes. Okay, I'm going to have you sit on the edge of the couch with your feet dangling over. A little bit further back. Okay, make sure we can see here. Okay, so we're going to check the Achilles. Okay, make sure you're relaxing your legs. Okay, got it on that one. Now we are going to check your patellar reflexes, so make sure your legs are relaxed. Okay, and on this side. Okay. All right, so seem to have normal reflexes on both sides. Now, as a cerebellar test, can you run the heel of one leg down the shin of the other? Mm-hmm. Do it with the other leg too. Okay, perfect. All right, let's make sure you can see your gait here. All right, now I'm going to get you to stand up and have you walk the length of the couch on your heels. Okay, can you turn around and walk back on your toes? Perfect. All right, now we're going to put this up again. You stand kind of in front of, right here, I'm going to get you to turn sideways. Okay, can you close your eyes? Okay, so normal amount of arch in the back. A little bit of arch in the back is normal. There's no lordosis, kyphosis observed, seems to be of normal posture. There's no scoliosis, no crazy spine problems going on. Okay, so next we're going to do open your eyes and then kind of turn around and face forward. I'm going to make sure we can see this part too. So this is a strengthened cerebellar test function. So can you hop on one leg and then on the other? It's not a test of balance, don't worry. Okay, let me put this up just one more time. All right, I'm going to get you to turn kind of this way. Then can I get you to lean forward? You can keep your eyes open. I don't want you to fall over. So we're just going to look at this spine for any bulges, again, scoliosis or abnormalities. So the spine is fine. Let me stand back up for me. All right, can you lean over again and kind of touch your toes? Okay, you can stand up. Can you lean back? Okay, and then can you lean like the shoulder down towards one side? All right, can you do it on the other side? All right. Well, I think that concludes the complete physical assessment.